It's good to be with you this morning. I have worked in the state of Utah in healthcare for a lot of years, and so there are some familiar faces out there. It's great to see some of you. I'm going to mention, I don't know whether I should or not, but I know Utah Healthcare Executives is also providing credit for attending here, and I've been a member of that group for a long time, and so I'm excited to both participate with you and get credit for it. How's that? So that's a great thing. So you come and speak to people and get credit for it. That's good. So I also noticed I was on the UHIMSS website yesterday to make sure I came to the right place at the right time. I still went to the wrong place, but at the right time, and got here. But I noticed that the UHIMSS chapter has received some awards recently, and that's very impressive. And I will note that the Utah Healthcare Executives also received some awards at the ACHE conference in March. So we have great organizations here that I think are leading our healthcare efforts as it relates to healthcare information technology and administrative work. I appreciated the prayer from Chaplain Slade this morning, and I especially appreciated that he mentioned the fact that we're all involved in patient care. And you don't think that sometimes when you're in healthcare information technology, and frankly at KLAS, where we simply measuring how all of you are doing in that field, you might forget that that's making a difference for patients, but it absolutely is. And so I appreciated that prayer. It reminded me of why I love being involved in healthcare and how grateful I am to have had a career involved in that arena. This is a very broad topic, right? Technology innovation, changing the face of healthcare. And I started my presentation looking at the myriad of things that we measure at KLAS and decided to narrow it to just two today. It seemed like I was going to go a mile wide and an inch deep, and I decided to go a little bit deeper and a little bit more narrow. So I'm going to really talk about the journey to usability and interoperability. And obviously this is going to be from a measurement standpoint. What are we seeing out there in the industry and the progress? So I'm going to talk a little bit about the need, which is, probably goes without saying, the opportunity that awaits us, and the challenge and progress that's being made. And I love this quote from Albert Einstein, where he says, "Out of clutter find simplicity, from discord find harmony, in the middle of difficulty lies opportunity." And this rang true to me right now as I think of the challenge that we're facing in terms of interoperability and usability. There's plenty of clutter, discord, and difficulty, but there really is also a lot of opportunity, and I really want to focus today on harmony. So about a month ago, or a little less than a month ago, my family and I went to a play up at the Home Box Theater in Kaysville. Has anybody ever been there? Actually, it's the Hope Box. I said that wrong. Hope Box Theater. If you've been to the Home Box Theater, then you'll have to tell me where it is, because I don't know where it is. Anyway, it's a way cool little theater. I mean, it's very small, community theater. I don't even remember how many seats, maybe 40 or 50 seats. Our family had half of them. But our family had half the cast, so that's why I was there. I have a brother who's way into this, and so we went there. And the play was The Music Man, and I don't know if any of you have ever seen that, but it's the story of a salesman who comes to a town. He's kind of a shyster, and he is trying to trick people into buying instruments and uniforms and start a band, but he knows really nothing about music. But one thing he does is he actually takes some chaos and clutter that's occurring in the town. He creates some chaos and some clutter in the town to help them see that in order to get harmony, you need to kind of come together. And he actually works with this town council pretty regularly to encourage, to keep them from catching him. He tells them that they have great pitch and harmony. And so every time they're after him, he gets them to sing. So I kind of thought of these folks when I was thinking about harmony. And it made me think of a few things. First of all, you can't harmonize by yourself or with a single instrument. Just can't do it. Well, some people are tricky and can kind of do that, but that's pretty rare. You have those people that play the instrument that has like 5 instruments on one. So there is that, but those are rare. You need multiple instruments and/or voices performing to the same sheet of music if you're going to harmonize. And each part has to practice and excel individually before they can really come together and perform. And then blending is critical. You're not trying to see who can be the loudest. You're trying to find a way to come together. And this seemed to be an analogy that made sense for me as I thought about where we are in healthcare technology and the need for harmonizing in terms of usability and interoperability. So what's the opportunity? Thinking of not harmonizing alone, frankly, you all have to have an instrument, right? And frankly, we're getting there. If you see the electronic health record as one of those instruments, perhaps the key instrument, the main instrument, the government has told us that in their survey process, somewhere between 85 and I've seen numbers as high as 97% of both acute care organizations and ambulatory facilities have an EHR. From our own measurement, there certainly are plenty of electronic health record vendors out there, and so virtually everybody has an instrument. Now, some play better than others, right? So we measure those. You can see that some perform better than others, but they also serve different needs. So it's not just a matter of how they score, but it's also what market they are taking care of. There's a lot of other vended products out there, some of which some of you may be involved in, and many of you have purchased a lot of these vended products. This is just an example in population health where there are a lot of vendors out there, many more than I'm showing you here. And frankly, KLAS measures 150 different segments and over 880 different products, or actively measure, and that means that we are getting quite a bit of information on those products. There's a lot of others that we have information on, maybe not quite as deep. So there's just a lot of instruments out there. There's a lot of people trying to help us make our instruments sing, right? We have, maybe you can call them band boosters or assistant conductors, and so you've got things like HIEs and interface engines and all kinds of people that are middleware vendors who are helping us to bring together all of these different products in a way that it actually harmonizes. If you've seen the play The Music Man, he uses what he calls the think method, right? Since he doesn't know how to teach him, he says, just think the minuet in G and you'll be able to play it, right? And at the end, they do play it, and it's pretty bad, but so the think method doesn't really work, right? So just talking about something, thinking about something doesn't, you absolutely have to practice. And there are organizations out there that are trying to get us to come together, like a Commonwealth or Care Quality. And last year, we measured a little bit of what was going on here to validate whether or not it really is happening, because there are big numbers out there, right, that you're hearing that everybody's doing this. The fact is that we're getting to where everybody maybe can do it. Everybody is not yet doing it, okay? So we've got to move beyond the think method, right, to where we're actually implementing some of these solutions, working together better to harmonize. And there is huge optimism, and I think it's warranted. I believe that a lot of these efforts that are occurring are going to bring tremendous results. Some of that is still to come. As far as electronic medical record vendors making a difference and helping us in this process, we have a ways to go. I'm putting a lot of charts and graphs up here. I'm not going to go over them. Obviously, they're too hard to see from a distance in some cases, and there's just a lot of information. But the point is here, this information is on a 9-point scale, and frankly, nobody scores particularly high in their ability to help us in sharing information. Most range between a 4 and a 6 on that 9-point scale. And so there is room for improvement, both alone and together. So the challenge really is orchestrating a large, diverse band is really hard. So let's start by talking about whether or not you can play your instrument well first, right? We said you have to learn to play your instrument first before you're able to then harmonize with the group. And I'm going to use that as an analogy for EMR usability. Here we have this instrument, this very expensive instrument, right? How well can we play it? And I will point out, I have to point out the tuba player there is my son. He thinks he's as cool as he's trying to look there. So. Which is a challenge for a parent sometimes. So KLAS has just initiated what we're calling our EMR Improvement Collaborative. We're working with providers across the country and reaching out to their end users, generally physicians and APCs, about their experience with their EMR. And we're asking them in 3 main areas about their experience. First of all, how's the product working for you? Second, how's your organization done in helping you implement this product and use it in your life? And what are you doing? What are you doing to maximize the use of this product? And so we're finding some interesting early information. So I'm going to tell you this is early, okay? We're not claiming that this is representative across the country. We're just suggesting this is what we're learning from the 9 or 10 organizations that we've talked to so far. As this gets bigger, this will actually be more informative. But we asked about their satisfaction as a clinician, an end user, that the EMR enables quality care. And the most interesting thing about this chart and the others I'm going to show you is the wide variety, right? And in some instances, these are the same vendor, right? So you may have the same vendor who had at one organization 82% satisfaction, and at another one 45%, and another one 41%. And so same product, different experience. What made it so different? When you ask them about their satisfaction that the EMR is easy to learn, again, lower scores altogether, but still a wide variety of scores. And then lastly, we asked them a lot more than this, but the 3 that I'm going to show today is how satisfied they are that the EMR promotes efficiency. And there, again, the highest score was 50%, right? So not great satisfaction. Efficiency continues to be the greatest pain point for physicians. So what data best predicts physician satisfaction? If we're going to make this thing sing for us, how do we do it? And what may be interesting is what doesn't impact it very much, these first couple of here. So surprisingly, many highly efficient physicians still have frustrations with their EMR. So that in and of itself, it may be their highest frustration, but it doesn't necessarily correlate at the highest rate to satisfaction. You might think the number of years of experience would make the experience better, and yet that correlation is not quite as high either. Not that it doesn't have a positive impact. It does, generally. But it is not as correlated to overall satisfaction. A little bit closer correlation comes from things like documentation method. How is it that we are able to get our information into the record, and if that's a little easier, whether that's through voice or dictation or some other way, that makes me a little more satisfied. And age is a medium predictor, but again, you might have thought that was going to be, highly correlated, and it's not highly correlated. The most highly correlated is the level of personalization. What are you doing as a provider to personalize your use of the EHR? This might be custom lists. It might be the way that you create sorts and have buttons. These are the kinds of things that actually help the end user have a better experience, and they kind of have to do that, right? You can't do that for them. And specialty, although it's kind of early data, seems to make a difference. Different specialties are having different experiences with their EMR. Just a little bit more information, early information from this research. So if you think about the engagement of clinicians, you go from very engaged to very unengaged, and not surprisingly, the more engaged you are, the more satisfied you are. It's not a perfect correlation. You can see that there are people who are satisfied that are unengaged. They're just not very satisfied very often. So you do have to engage in order to, again, make this work well for you. Their satisfaction versus their self-identified proficiency is here. I love the last one, right? If you're a train wreck user, if that's how you identify yourself, you're not very satisfied usually, right? You got to engage a little bit more than that. On the other hand, the expert users are generally more satisfied. Satisfaction using years of experience is an interesting one. There's kind of this middle ground where you've been on it for 4 years and you start to kind of go down in your satisfaction. I think the product may become stale for you at some point, saying it should be able to do more. I've been doing this a long time. I'm actually pretty darn good at it, and it should be able to do more for me. So again, interesting information. So there's a lot of work to be done in terms of making this product work well for us so that we're good with this product. Therefore, we can start talking about expanding to other applications. We can expand to interoperability and sharing with others. So when I think about playing well with other, I'm going to use that analogy to talk a little bit for a minute here about interoperability. KLAS has been doing research on interoperability for about 4 or 5 years now. Last year, we took an approach that really looked at the end user's experience with information brought into them from outside their organization. So that's the question we were asking you, providers, about your experience with sharing information. And we created what we call a home run. We basically said, if you're able to nearly always or often access the information you need, and it's locatable in either an automatic or simple way, and the clinical view is integrated in your EMR or in a tab within the EMR, and let me emphasize these are and statements, and it's impactful on patient care nearly always or often, then we call that a home run, right? If you can do all those things, that's a home run. Sad news is that if you put those as and statements, that only happened about 6% of the time at the 400 organizations that we talked to. So we have a lot of work to do. Achieving harmony is really hard. Home run rates by vendor were quite varied as well. Now there's two bars here. The blue bar is really if you were sharing with another organization outside your own that had the same vendor as you. So that's the blue bar, and you can see that's higher generally for everybody, and particularly higher with Epic. But then if we asked them about sharing information with a different vendor at another organization, nobody did well, right? I mean, nobody did great even on the first one, but nobody did well on the other one. The highest was at 12%, and the lowest was at 0. I'll move quickly so you don't focus on the 0. So we asked about barriers. I mean, why is this so hard, and what are the challenges? And I think not surprisingly to anybody, the lack of national standard infrastructure actually showed up as the most common barrier and challenge. Now that doesn't mean there is a lack of infrastructure completely. Sometimes it's interpretation of the infrastructure, right? It exists, but we all interpret it differently. But infrastructure is a huge challenge. Standards are a huge challenge. And one thing that came up a little more prevalently than other things was the need for a national patient identifier. And I think we're all aware that there's a lot of effort going on there from CHIME and other organizations, and hopefully at some point that will be solved either by us as an industry, which there are a lot of creative solutions out there, or at the government level. Most likely the former than the latter. Technology complication and drawbacks was the second highest one. Again, not surprising. And people saying we really need systems that give us what we want, when we want it, how we want it, where we want it, right? I mean, we can get the information, but it's just not that useful. So that was considered a technology drawback. So bringing this all together, what do we need to be doing? What's the progress? Well, in terms of usability, coming soon, right? From our perspective, from the KLAS perspective, we're only just now measuring it, and I can't really tell you how it's progressed, but hopefully we'll talk to you again another time, or you'll look at our information in a year and you'll see the progress that we're making. Our hope is that we can bring organizations together to have conversations about it, that vendor X site that is at 80% might present in a webinar to the organizations that are 30%. What are you doing differently? How can we better make our instrument play for us? In terms of interoperability, we are in the middle of a study right now, maybe a little past middle. And so we have some preliminary data I'm going to share with you, but I can't emphasize enough that this is preliminary. This information will change by the end. Dramatically? I don't know, probably not, but perhaps a little bit. So are we seeing any progress? A little bit, right? I mean, this would suggest that from a vendor rating standpoint, both with different EMRs and with the same EMR, this has gone up a little bit. The third set of bars to the right there is a non-customer rating a different vendor. So this is somebody who's on Epic and they're rating Cerner. Those are about the same this year as they were last year. We actually asked a new question this year. We asked provider organizations to rate themselves. We didn't ask that last year. How would you rate your organization in your willingness to and support of sharing information outside your organization? And I see this as interesting information to suggest how fair are you as providers being to your vendors, right? A little bit. I mean, if you say, yeah, they stink and we're great, then maybe there's a little bit of concern. If you say they're wonderful and we stink, I don't know how that is, but you're actually pretty close. You as providers are basically saying, yeah, our vendor could do more and we could do more. And so that's a credit to all of you. We didn't ever doubt your honesty, but it's nice to see it here. And then interoperability stages, so that kind of home run we were talking about earlier, this is where I see the most impressive results so far. I hope they hold true to the end of our survey process. But right now we're seeing improvement. Now, lest we get too excited, if you look at the last column on the right, those would be those home run rates that last year were 6% and now are 13%. I don't think any of us are going to write home to mom and dad and say our batting average is 130. We'd rather it be closer to 1,000. But the fact is that that's significant improvement. If it really goes from 6% to 13%, we're finding more harmony with the use of this information. The barriers seem to be somewhat the same. They're a little more granular this year. We asked it for a few other categories, but still standards are at the top of the challenge list, and technology-related issues are also up there. One that was a little bit surprising, because it was lower last year, is your competitors' unwillingness to share. And again, it's early. That might move down the list by the time we're done, but that was much lower on the list before. We're hopeful that's not a trend. And then what's the problem? I mean, since you often can get the information, but then it doesn't solve all the problems on the far end of this equation, what are the biggest issues? And I sometimes call this the Goldilocks issue. They either have too much information or too little information, and it's never just right? And so that's one of the issues, too much unneeded data, or the information formatting is unwieldy or cumbersome. And so I can get it, but it's just hard to work with. And so there's a lot of room here, again, lots of practice, right? We've got to make our instruments perform well, and we got to improve our ability to make them work well. So it's a journey, right? The journey to harmonizing to interoperability is a journey, and we're only measuring in this information I showed you how well we're doing with our EMR, how well we're doing with sharing information EMR to EMR, whether that's through another medium like an HIE or whether that's direct. But there's a lot of other parts of interoperability we're not yet measuring, and so we're having conversations with vendors and providers and facilitators of interoperability about what we should be measuring to help understand even the bigger picture. And so we're talking about conversations about post-acute care and interoperability, about medical equipment and integration and interoperability. And so as well as end-user feedback like we got on the EMR, we want to know that information about interoperability as well. So there's a lot more to be learned even than what we're learning right now. It's a broader issue and challenge than even I've represented here. But we're committed to trying to find out from you how it's working and to help you find ways to make it work better. At the end of the day, you could ask yourself, what are you doing to help bring harmony to this process? And with that, I say thank you, and we'll turn it to the next person.